So, does she have any question about that?
No.
No, makes sense. So,
Yeah, it's really nice to review.
good. So, what I want to explain now is two other concepts. And those concepts are related to this brochure that she just read. And she read it, right?
Yes, I did.
All right, so when people have symptoms, if we are only dealing with the symptoms, that is called relief care. So can she think of any kind of examples of what relief care might be like?
Like a broken bone.
And what would the treatment be for that?
You would put on a cast, perhaps. And then, you know, have that on for a couple months and try to heal that. Something similar to that.
Yeah. Well, it's more like something like taking aspirin for a headache.
Mm-hmm.
Or taking some other medication.
Or like when you get cuts. Like you put, you know,
yeah, a salve would be
salve
like,
and a Band-Aid on it.
Right, right. And so, with a cut, for example, the symptom might be pain, redness, and the body's own healing ability actually is what heals it, and not the salve. The salve supports the body's own healing ability. But let's say for example, with her arm and shoulder pain.
Mm-hmm.
Has she tried any other things that helped?
Stop, for instance, working. If I type, you know, I'll stop, take a break, stretch 15 minutes, and then go back to work. So taking a break and stretching.
So that helps. But if she starts working again,
it comes right back.
Right.
All right.
So relief care is a temporary reduction in the symptoms, but it does not necessarily get to the underlying cause. And so what we call working on the root cause is corrective care. So I'm not writing that up here. So corrective care deals with the underlying disease, malfunction, and stagnation. And by eliminating the stagnation, then the function increases and the body's natural ability will improve. And then the symptoms should disappear.
So does it, repetitive RMI, what about that? That's repetitive motion injury?
Yeah. The repetitive motion injury, if we can get to the underlying pattern that is causing that symptom and the dysfunction, and we can correct that, then we get closer to returning to 100% function. In workers' compensation, and she has a work injury, so in workers' compensation, they will pay for acupuncture as long as we are showing improvement in symptoms or improvement in her ability to do more activities.
I see.
And even if she then, if we get rid of the symptoms, It may be possible that we have not gotten to the totally eliminating the underlying stagnation. But they primarily pay for treatment dealing with symptoms and not dealing with the underlying stagnation.
Right, yeah, I understand that.
So that's the limitations of certain insurance systems.
Exactly, yeah.
But if time and money was not an issue for her, is she preferring relief care or relief and corrective care in combination?
Yeah, of course I would like corrective care.
Right. Yeah. That's what smart people say.
Yeah, okay.
So I just wanted to explain the difference of those two.
Yeah, and that's long term, it seems, that would be compared to relief care.
That's right. And to actually get the stagnation completely gone may or may not be possible.
I understand.
Yeah. So for example, because she signs so much and she uses the computer so much at work also, there are certain patterns that she has created between her brain and the muscles that enable her to do that. But sometimes those patterns are less efficient than we might want them to be.
Mm-hmm.
And so to change those patterns sometimes is possible and sometimes it's not.
Right. Okay.
You drive a car?
Yes.
So it's like when we first learned to use the accelerator. We don't know how hard to push or how little to push, and eventually it's like we don't even think about it. And so the way that we actually push the accelerator might be very efficient, or we might have a strange way of doing it that would cause like muscle contraction in our buttocks or something that could cause back pain. And so the same thing with signing and working on the computer. There might be particular ways that she does it that she just developed on her own, which are fine, and she gets her expression across. But there might be some slightly different way if she did it. She would have less pain or less possibility of it recurring.
Right, that's why I try to use my left hand when I can.
Exactly.
Excuse me. So
it breaks that pattern too.